How we diagnose psychiatric disorder? We can put the diagnosis of psychiatric disorder from three elements. First, from the history, from the mental state examination, and for the age regarding to clusters of the symptoms and signs. From those, we can read the diagnosis. First of all, we know about the history. It is containing the complaints, and this is said by the patient, his own words. Which and what is related to this complaint? You know about the why, how, what sort of complaint, how it started, when it started, what sort of duration, onset, the course of the complaint, other vital signs related to the complaint. After that, we go to the family history. We concentrate about if there is hereditary factor, and then to the personal history, about his development, his milestones with schooling, education, and job, and medical illness, and the past psychiatric history. We do whatever we need about the investigation, about confirming or ruling out if it is organic or functional disorder. When we review, either we know that it can elicit the symptoms and signs by verbal or non-verbal method. We cluster the main or salient feature from the mental state and clustering them, and we put forth differential diagnoses. Could be organic, functional psychiatric disorder, which either psychotic disorder, neurotic disorder, personality disorder, and neurodevelopmental disorder. By putting with and against every criteria from those, we started by the organic. If there is no organic underlying causes, and this can be confirmed by lab and by lab tests and by making memory and concentration, we can rule out the organic, which means that there is psychiatric symptom due to organic causes, like if there is an anxiety symptom due to thyrotoxicosis, for diabetes, there is delusions, and there is underlying dementia or underlying space-occupying lesion. If we rule out the organic causes, we begin shifting to the functional disorder, which is grouping by psychotic disorder or neurotic disorder, and we know psychotic disorder, there is delusion, hallucination, disturbance in behavior or for speech, and for the neurotic, there is no hallucination, no delusion, and reality testing is all right. If we choose one, we going to the schizophrenia first. If there is no schizophrenia, we go on in the mood disorder. If there is no mood disorder, to the neurotic disorder. And if there is nothing about these, we look about if there is a personality disorder, and we know that personality disorder means that there is mal-enduring pattern of behavior and thoughts, which is started at adolescent and fixed at age 18. We know about the personality disorder. It is three types, cluster A, B, or C, and we can, from the salient feature, know the characteristic feature of any of these branches of personality disorder. If there is no personality disorder, we go back and relate it to the age, either in childhood or adult or old ages. We concentrated about milestones, and we can give something about childhood disorder. If we reach the diagnosis, and we usually reach the diagnosis from either to follow ICD-10, 11, or DSM-5, if we reach the diagnosis, one of these, we can do the knowing the etiology, and from the etiology management in short term and long term, and then we go to the prognosis. Thank you for your listening.